Okay, we're going to talk about insulin resistance. We're really going to talk about blood sugar. We say insulin resistance, we say diabetes. We say these things because those are nice catchphrases, but at the root of it is a blood sugar problem. And this is probably one of my favorite subjects to go over because it's probably the root of many folks' problems without them knowing it. If you can solve this problem, you can solve a lot of different health problems. I'm going to go through just a few things here. First thing we want to do is just identify with a few of these things, if you do or you don't. Any of the following may indicate a blood sugar metabolism dysfunction. Brain fog. Did you know that the brain uses glucose for energy? And if the brain doesn't have glucose, guess what it doesn't do good? Nothing. It doesn't think good, it doesn't concentrate well. As a matter of fact, it even throws off emotional things, neurotransmitter imbalances. You've got a whole host of problems that do this. There's also one other aspect that happens. If the brain does not have enough energy, then it does not have the ability to fight off toxins like it should. You know, there's things called neurotoxins, and you've heard of these excitotoxins. You've heard of those, kind of a buzzword here lately. Excitotoxins are things like aspartame, MSG, things like food enhancers, and so on and so forth. Well, as it turns out, your blood-brain barrier, which is the dam that's supposed to keep all that bad stuff from getting in your brain, can get broken down. And when it gets broken down, things can leak into the brain. You've heard leaky gut syndrome? We can actually have leaky brain syndrome. Don't go around making that the new thing you tease people about. But we can have leaky brain, and what's happening is these toxins can get in, and if there's not enough energy in the brain cells to ward that off, then there becomes a toxic effect, and these are things that lead to people having things like Alzheimer's, Parkinson's disease, multiple sclerosis, and many things like this. Now it's very interesting, just to throw it out here, I don't know if you've heard this, but Alzheimer's is now considered diabetes type 3. That's what they're calling it, and because it's a very similar, not similar, it's the same mechanism. Okay, nervousness. This is probably one of the #1 complaints that I see when people have blood sugar issues. I'm just feeling nervous. Cold sweats. Now this is kind of down the spectrum. Some people who have blood sugar issues don't really have cold sweats, but if you have cold sweats, you probably do. You probably do. Depression, OCD. Vertigo. Doc, I just feel weak. I feel dizzy. I feel lightheaded. Here again, that would go back to the brain not having enough energy. Headaches. Oh my goodness. I wake up in the morning, I have headaches, Doc, and I don't feel like eating. I'm nauseated in the morning. I just don't feel like eating. This is kind of a classic sign of blood sugar problems. Or I just have that afternoon headache. I get a headache in the afternoon and I eat something, I feel better. That's another sign. Mood swings, nausea, tremors, fatigue. Does any of these sound familiar to anybody? Don't raise your hand, please. Anxiety. Anxiety. Poor coordination. I just about tripped when I said that. So anyway, I did eat my broccoli. Weakness, irritability, inability to concentrate. Have you ever noticed that? Sometimes you're just trying to concentrate and it's like just have a block. Can't do that. Migraines, PMS, melancholy, confusion, speech difficulties. There's all kinds of things that can relate to blood sugar problems. Rapid heartbeat, digestive disturbances, and insomnia. Here's what I want to point out, and if you don't get anything out of this, and I certainly hope you do, this is a really major point right here. So put a star beside this. Reactive hypoglycemia is not a disease, it is a driver of disease. This is the reason why it's so enigmatic. It's difficult in the health profession, the medical profession, to diagnose this because it's not an entity like a disease in itself. It's not like somebody has coughs and we do a sputum and we see some bugs in there, so we call it this, that, or the other. It's not like that. It's something that's more abstract than that. As a matter of fact, somebody can have normal blood values. They can have a normal glucose on their blood test and be normal. They can even do a glucose tolerance test and come out normal, and you think that they don't have hypoglycemia, but they do, because it's really the insulin that's spiking if that's not checked. We'll talk about that a little bit later on. But the point I really want to make here is that many people are suffering from sicknesses and diseases that can be prevented and reversed by simply getting blood sugar in alignment. And we'll show you how to do that. Moreover, hyperglycemia, this is a quote from a book, has been called the great imitator because of strange, startling symptoms. Some experts list as many 125 of them. Can mimic a frightening array of diseases and conditions, including bipolar disorders. Some people can have what they would diagnose as bipolar disorders. It happens. And really, the root of it was Hypoglycemia. Fix hypoglycemia, you get normal blood flow, normal sugar in the brain, and all of a sudden things start working properly. See, we really think about these things differently. What we do is somebody has a disease, they have the condition, and we start fighting that. What we need to do is come back and go after the drivers of these conditions. Does that make sense? Because if you can solve the cause of the problem and allow the body to heal and do properly, then you're in a situation the body can be healthy and well. If anybody wants the PDFs from here, you're welcome to have them. I'll be glad to share them with you. I'll give them to you. So I'm not going to read through all these slides. Some of these things I have on here just in case you're reviewing afterwards. Hypoglycemia doesn't fit into a neat category easily recognized through traditional lab testing. You certainly can see it through lab testing. There's something called LDH. If it goes 140 or below, you're looking at possible hypoglycemia. Hemoglobin A1C, when it starts raising up, it gives us information about the sugar metabolism. Glucose tolerance test. You look at glucose, give them a shot of sugar, and then do it again and see what happens. But anyway, given the vast array of symptoms. By the way, nobody laughed at my picture. I thought that was hysterical. The vast array of symptoms and confusion they can generate. Doctors often shrug away patients' complaints as the imaginings of hypochondriac and dire need of psychiatric care. Now, I didn't write that. That came from a book, by the way, because that sounded actually a little harsh when I was typing. It didn't feel as harsh, but it did when I read it. But anyway, but it really is true. How many people do you know? And if it's you, that's fine. Have gone to the doctor or gone to a doctor, and that's probably coming from your head, or is there something it's probably psychological, or you go to a psychiatrist. Now, I'm not downing that because there certainly is a need for that. But I want to pull back on this issue and say that you got a blood sugar problem. You need to solve that, and then let's deal with the other things, because you solve that, it'll solve a lot of problems for you. Genetics and epigenetics. Isn't that a nice picture? I didn't hear any ahs. Genetics. Very interesting. Genetics, we used to think that genetics were the end-all, be-all. They really are not. Genetics are, if you will, they're the plans, but the architect is really the blueprint, or they're the blueprints, but the architect is really what puts the things in motion. Now watch this. Genetics will determine, eye color, hair color, things like that. But they've come up with a phenomenon over the last year called epigenetics. You're going to be hearing a lot about this in the coming years. You're going to hear about genomics, and you're going to hear about nutrinomics, and you're going to hear about a lot of these things, a lot of these buzzwords coming out. But epigenetics, what is epigenetics? Epigenetics is things that you do in your life will turn on or turn off genes. Like you may have a gene for, and I'm pointing at you, Wayne, you may have a gene for to be a diabetic. But if you never turn those genes on, guess what? You'll never be a diabetic. But you may also have genes that, you have more genes that keep you from being diabetic, but you're so hard on yourself, those few genes that will turn on diabetes, you kick that thing into action so many times and now you have it. So that's called epigenetics. Genetics are sitting there, but it's what we apply to our life that is really determining our outcomes. Does that make sense? This is a very important distinction, because I know a lot of people say, well, that happened to my mother, so that's happened to me. There can be a case for that, but when we're talking about chronic degenerative diseases, diabetes, we're talking about blood sugar issues, we're talking about even many cancers, 80–90% of cancers, heart disease, we're really dealing with, regardless of the genetics, you really have, you have a way of turning that stuff on and turning that stuff off. Does that make sense? So epigenetics, look that word up. This is Pima Indians pre- and post-Westernization. Same genetics. These people have the same exact genetics. The only thing they did is they moved from their culture into a Western culture, and then the bottom, of course, you can see what happened. Started the central adiposity, or the central obesity. By the way, the central obesity is really the bad stuff, because the central obesity, guess what? It means your organs, it's getting fat around your organs. I just wasn't looking at you, Mike. It's getting fat around. I picked the skinniest guy to say that. You're getting fat around the organs. Now, the tendency is for guys to get the central obesity, and for the ladies to gain the pound, the hips, and different places. And the reason why that is because women store fat in the subcutaneous tissues. That's the way it works, because of the estrogen that's going on. There's other factors, but estrogen is a big factor. Guys, when they start getting low testosterone, as a matter of fact, when a guy comes in here and he's not a beer drinker, and I don't see any of the other signs, but you look at him from the side and he's skinny in the chin, he's skinny in the neck, he's skinny in the legs, and he's got like that. My first thought is this guy probably has low testosterone. It's important for me to know that they have low testosterone, but you know what's more important? Figuring out if he does have low testosterone. Why do you have low testosterone? If you're around me very long, you'll always hear me say this. Find the driver or what's causing your condition. Look behind the curtain and see what is making this happen. If somebody has low testosterone, they have any kind of issues, you find out what it is. Okay, this is another one. This is Australian Aborigines. Very interesting picture. They took a group of Australian Aborigines from the outback. They took them out, and they were living in a Western culture. And they began doing what? Guess what? They started looking like the Pima Indians, started to get back. So they did a study, a very interesting study, and they took a group of those individuals, and they put them back in the outback and had them, you know, hunting, fishing, gathering, doing all this stuff. In 7 weeks, all of their biomarkers returned to normal. They were thinning down. They were completely back to where they're supposed to be. Why is that? Because you can turn off genes, and you can turn on genes, and you can turn off genes, and so on and so forth. So now you don't want to continue turning on genes over and over, because then you can get to the point that's very difficult to turn it around. Okay, I'm going to show you a picture right here, and I think I am. Let's see if I am. I'm going to show you a little story about insulin here. Oh my goodness, I can't believe that turned up. Okay, good. Can you hear that?
Most of us think we only put fat in our fat cells when we eat too much. But as Gary Taubes explains in Good Calories, Bad Calories, your fat cells are like rechargeable fuel cells. Every time you eat, you store some fat. In between meals, fat comes out of your fat cells to provide the fuel for your muscles and organs. If you're naturally thin, it's because you have efficient fat cells. Fat goes in quickly and it comes out easily. Your body doesn't need much fat because the little bit of fat you do have is a reliable source of fuel. If you're predisposed to be fat, it's because you have greedy fat cells. When you eat, you tend to store calories as fat instead of burning them. And when your other tissues need those calories, the fat comes out slowly if it comes out at all. What are they doing? Did one of you guys forget to pay the food bill? Are you going to eat all that?
The end user of food that we eat are our individual cells. And it doesn't matter if it goes in our mouth. If it doesn't get to those cells, we starve. We starve at the cellular level.
And so you do exactly what your body is telling you to do. Come on, eat something. Steak, will ya? You eat more. In other words, you're not getting fat because you're eating more. You're eating more because you're getting fat. Most of us weren't born with greedy fat cells, but we can certainly make them that way. When you eat too many carbohydrates, you raise your blood sugar. Since high blood sugar is toxic, your body releases insulin to bring it down. But your body can only burn a little bit of sugar at a time. So what happens to the rest of it?
Well, your storage sites for carbohydrates are limited. We've got unlimited storage places for fat. So the body ends up just converting the carbohydrate to fat.
And after bringing down your blood sugar, insulin does its other job. It tells your body to store fat. When you have a healthy metabolism, it only takes a little bit of insulin to bring your blood sugar down, and then everything goes back to normal. But over time, that can change.
The cells can become resistant to the effects of insulin. In essence, when that happens, insulin is talking, but the cells just start listening. And so they don't get the message from insulin, so they don't do what they're supposed to do.
Hello? Stop hitting me. I'm not hitting you. Stop hitting me. I'm not hitting you. And so your body does what it has to do. It starts producing more insulin.
You finally reach the point where your insulin's high just to keep your sugar normal, even if you're not eating any sugar. And then when that happens, then it starts to drive stuff into the fat cell, and it reaches this point where all of a sudden, bam, you get fat.
Okay. All right. Okay, so the reason why I want to show you that is because there's a metabolism thing that's going on with insulin, and that there's a curve. So your blood sugar should stay somewhere between 80 to 100, somewhere in that zone. So when you eat food, what will happen is your blood sugar will go up because you eat food and the sugar gets in the blood. Does that make sense? And when the sugar gets in the blood, then the pancreas makes insulin. Then the insulin gets a hold of the cells and opens the door for glucose to go in, and that causes the glucose to go down in the blood because it's going into the cells. Does that make sense? And then the pancreas releases something else called glucagon to bring it back to normal. So what happens, you have this 100 here, you have this 80 here, and it's supposed to stay in this tight zone. So stay just like that, and as long as it stays in that tight zone, everything's fine. It's all about balance. Too much sugar is bad, too little sugar is bad. Does that make sense? And so what happens is that over time, your body continually sees these surges or spikes of carbohydrates. Where do we get those from? Does anybody know? Surges of carbohydrates. You're laughing. That's pies, cakes, candies, and this and that, but I'm going to tell you something else that's going to surprise you. It's also coming from the whole wheat bread, the organic whole wheat bread you're eating. It's coming from the oats. It's coming from the barley. It's coming from all these grains that we're consuming. We're consuming grains, and we're really, over the last few hundred years, started really going down on the grains. And the difference is today's grains is not like the Samoan type grains we used to have. These are grains that are modified and have been changed and altered, and they have more starch in them, they have different enzymes in them, they have different genetic makeup, and so it's reacting differently in our bodies, so it is creating a problem in our blood sugars. So anytime we get an insulin, or anytime we get a sugar spike, what does the body have to do to counteract that, to keep the blood sugar from going too high? It has to slip the insulin out there, right? Now, if you have too much sugar floating around your blood, so what he was saying is that the body doesn't really store sugar really good, so it just converts it to fat. Okay? And not only that, but when the body's seeing a bunch of glucose in the blood all the time, it just continues to put insulin out into the system. Insulin, you might be surprised to know, is actually toxic to the body. In little bits, it's really okay. The body can clear it, it's fine. But it's toxic to the body if you have it in large amounts. As a matter of fact, there was this veterinarian that was doing some experiment on a dog, and he had him cauterized and was working on his leg and had the femoral artery opened up. Up above on a shelf, his hand slipped or something happened, and he dropped a vial of insulin, and it fell right inside, the liquid fell right inside the artery of the femoral artery of the dog. And within 3 months, the dog was completely 100% occluded with atherosclerosis, hardening of the arteries. Why is that? Because insulin is so caustic to the body, it actually causes damage to the inside lining of the arteries. This is the reason why people who are diabetic have such problems with heart disease, eye problems, kidney problems, other problems, because of what's doing to the blood vascular system. So insulin increases inflammation. Do you know what? A lot of people are getting these sugar spikes, their blood sugar's a little out of whack, so their insulin's a little bit higher. They come into me and they say, you know, Doc, I don't know what to tell you, that shoulder just always hurts. Just always hurts. Man, it just always hurts. My right knee's just started swelling up. You know, I've got this pain that's going in my neck, and it goes right down into my shoulder, and don't realize it's increased insulin, or can be from increased inflammation from insulin being out of check. Increased testosterone in women. This is the PCOS. This is the polycystic ovarian syndrome in the ladies. Increased estrogen in men. That decreases testosterone, makes the belly come out. Increased oxidative stress. By the way, there's two fundamental causes of all disease that are chronic and degenerative. There's two fundamental causes. Listen up. They're this: oxidative stress and inflammation. That's the whole ballgame. Anything that creates oxidative stress in the body or inflammation will cause you to get sick and grow sickness and disease. And guess what? Blood sugar problems do both of those things, and in spades, if you will, big time. So it increases cholesterol, blood, and here's a big one that people overlook, and that is that when you have insulin in your system, it causes the liver not to be able to detoxify the system, and this is a very important function of the body. You must be able to detoxify. Okay, this is just a picture of what it looks like. Here's when an insulin comes into a cell right here, and it twists that. It opens the door for the glucose to go in. We kind of know how that goes. You can think of it this way. Insulin's kind of like a key that opens the door for the glucose. We know how that does that. By the way, I'm going to get onto this, but let me just say this real quick and say there's one instance that the body doesn't actually need insulin for the glucose to go in the cells. When is that? When we're exercising. When you're exercising, it causes your body to work in a different way so that you no longer have a need for insulin to open the door. By the way, this is a key to getting back control of your glucose. All right, is this you? Inability to lose weight, cravings for sugar, fatigue after meal, migrating aches and pains, abdominal obesity, increased fat storage. Anybody, a low thyroid? You know, we did a talk 2 or 3 months ago on low thyroid. The reason why we're doing this one right now is because a lot of people who have thyroid problems, if they'll straighten this problem out, the thyroid problem will straighten out. Not at all, because sometimes there's a bacteria or there's something going on in the gut. There could be food sensitivities. There could be other reasons that's driving it. But like I said a while ago, if the thyroid problem's coming because of the low blood sugar or the aberrant blood sugar metabolism, then you'll be able to fix that. Okay, very good. All right, I want to go through this really quick. There's something called insulin resistance, and insulin resistance looks like this. You saw the picture where you saw the key going into the cell and open it up and then the door goes in there. Well, what happens is tissue cells have receptors on, like if I had a tissue cell here, they have little receptors. And those little receptors are very specific for different substances, different hormones. There are some that are sensitive to insulin. So when insulin floats by, it grabs a hold of that and then it opens the door, glucose goes in. But what happens is when you start getting too much insulin in the system, when you get too much insulin in the system, then the cell, to protect itself, it's self-preservation, it's protecting itself, it will blunt that receptor so it doesn't recognize the insulin. So what's happening there is now the cell is not getting the sugar in there because it's not allowing the insulin because the insulin's been caustic or toxic to the cell wall. Does that make sense? And so over time, what is the body's response to this? To make more insulin, right? So the body continues making more and more insulin, and you become more and more resistant to it. You see how that goes? Now watch this. Somebody starts out with normal sugar metabolism, they go to hypoglycemia, then they go to pre-diabetes, diabetic, and then they become a diabetic. That's the road. Nobody's ever a diabetic without going through that thing. I'm not talking about type 1, I'm talking about the type 2 diabetes. You have to go through that road first. You cannot be a type 2 diabetic without first being hypoglycemia, pre-diabetic, and a diabetic. Does that make sense? So what happens is, if you'll take this curve, the more resistant you become to insulin, the more you move toward the diabetic state. So what's happening is the body's first response is make more insulin. When you make more insulin, it may initially solve the problem of getting sugar into cells, because if you put a lot of insulin in there, at least those, the receptors are going to see some of it. But what happens over time, the more insulin you put in there, the more resistant they become. By the way, this is really a primary standard medical treatment for hypoglycemia or pre-diabetics, is to give them something that will stimulate the pancreas to make more insulin. Because if you make more insulin, what happens is it really will work in the short term. But the problem is it makes you more insulin resistant, and it drives you more towards that curve of being diabetic. There's better ways to handle that. Okay, but the liver becomes the first organ to become insulin resistant. This is the person that goes to bed with a blood sugar of 90 and wakes up with a blood sugar of 120 and they didn't eat anything. They say, what happened? That didn't make any sense. What happens is your liver dumps off the sugar into the bloodstream. So that's your insulin resistance, resistant if that's happening. Muscles, fat cells. By the way, fat cells when they become resistant to insulin, that's when you quit putting on weight. So it's not resistant first, and so the fat cells are getting all kinds of stuff in there, and you're getting bigger, 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 and then finally your fat cells say, you know what, I don't like that stuff anymore, and then the weight gain stops. Endothelial lining, this the inside lining of the artery, does not become resistant. That's a big key. Watch this. The inside lining of the artery is not resistant to the insulin. Why is that a bad thing? Because it continually does damage. No matter what, it'll never get immune to that damage. Okay, insulin, what's the link? Centenarians studies show only a common link is low triglycerides, blood sugar, and insulin levels. So, these are people 100 years old. They ask them everything from how you ate, how you felt, what kind of relationships you had, all these different parameters, and the only thing they could find out is that they had low triglycerides and blood sugar and insulin in control. You control your blood sugar and insulin, guess what? Your triglycerides will be in control. When you have high triglycerides, it's just a sign that your body's lost its ability to really deal with sugar. So, see that thing right there? Too much sugar converts to fat. The fat is triglycerides. So, does that make sense? Okay, insulin is a common denominator in all chronic degenerative disease. The way to treat virtually all of the so-called chronic diseases of aging is to treat insulin itself. And now I will back off, as Dr. McCullough said that, but I will back off and say this. Why is the insulin high? To solve the problem, solve the problem, solve the problem. If there is a single marker for lifespan, as they are finding in certain areas, it is insulin, specifically insulin sensitivity. Blood sugars reduce, your blood sugar of 120 reduces your phagocytic index by 75%. What that means is just a blood sugar rise of 120 is going to decrease your immune response. You're going to be more susceptible to colds, flus, different things. Increased levels of insulin, growth levels. Okay, I want to make this point. I'm going to skip through this one right here because I want to get to this right here. Long-term effects of intensive glucose lowering. Pay attention. This is really a good one on cardiovascular outcomes. Okay, this is New England Journal of Medicine. So this is one of the big four medical journals, and this was published back in 2011. So it's not an old study. What they did was they took a look to see. They took a group of people who they were intensely watching their blood sugar levels when they're diabetic. So in other words, as soon as that blood sugar went up a little, they're clobbering with insulin. Shouldn't use that word, but they're putting the insulin in there to keep, they're tightly regulating the blood sugar through insulin. Does that make sense? Then another group, they were letting it go looser. They were just letting it go. They weren't letting it go, but they just weren't if it went up to 120, 130, that's fine. They were letting it rise and not as tight a control. The group that they had not as tight a control lived longer and died less. So the people, yeah, no. Watch this. That's that study. That's that study. That's that study. So these are the three studies that just came over the last few years that are showing the more tightly you regulate your blood sugar. This is not some weird theory I had. This is documented stuff in the medical literature showing that if you tightly regulate your blood sugar by insulin, putting it in there, you will cause yourself to die earlier and through complications of the insulin, because the insulin's toxic in itself. Now, I'm not for just letting things go. You got to fix it. But what I'm saying is, the fix is not trying to fix that thing that's out there that's just the effect of the problem. We got to get to the cause of the problem. So, okay, good. Heart attacks are 2 to 3 times more likely after a high carbohydrate meal, and specifically not after a high fat meal. Never thought that, did you? Never would have thought that. You're like, oh man, I ate that big turkey dinner and all that, and I watched the Super Bowl, I did all that, and that's what did it? No, it's that 3 things of pie you ate right after you ate the turkey. It wasn't a turkey. The turkey was your body say, thank you for the turkey, but please, keep the other stuff away from me if you could. Okay, increased blood sugar increases insulin, which kicks in the sympathetic nervous system. We're going to talk about this just a little bit. There's 2 areas of the nervous system. There's actually 3, but for our purpose there's 2 primary. One that slows everything down. It's the healer. It's the digester. It's the one that causes you to digest and rest. And the other one causes you to fight or flight. That's the one that you deal with stress with and so on and so forth. When you have insulin spikes, it increases that side of the nervous system that is the stress oriented. So do you think it's good to have the effects of stress going on in your body all the time? No, it's not. It causes catabolic responses, which is a fancy word for saying it tears your body down. Okay, metabolic syndrome profile. You've probably heard of this. Insulin resistance metabolic profile, metabolic syndrome. Some people say they're synonymous terms. I wouldn't argue with that. I think that insulin resistance is probably more of a spectrum, while metabolic syndrome is a defined position here. If you have 3 out of the 5, you're considered metabolic syndrome. Blood pressure 135/85, waist size 40 inches for men, 35 inches for women, fasting glucose over 100, HDL. This is a big one. HDL. That's the only one of the cholesterols that the small particles and all the other, but I'm talking about traditional testing the lipid profile. We say HDL, LDL. HDL is important. Men, we've got to be 40 or above. Actually need to be over 40. And women, we need to be over 50. This gives us good information. Triglycerides over 150. This is metabolic syndrome. I just threw that in there so you see. Insulin resistance, diabetes, high cholesterol. I know that looks bad, but let me just explain this right here. We've got all these problems going on out here, and by the way, by the year 2020, they are estimating that 50% of the American population will be pre-diabetic or diabetic. 50% of the population. Now today, we are seeing kids at 15 years old have strokes. We are seeing kids at 5 years old with plaquing in their arteries. We're seeing type 2. By the way, back 15 years ago, 3% of your diabetes in children was all type 1, where as an autoimmune, immune system chewed up the pancreas, they're not making the insulin. Now, that rate has risen up to 40% of our diabetics and children are type 2, which means chronic degenerative disease. So we have 8-year-old kids running around with diabetes that is from lifestyle. Now, you can say, well, the mom's just not feeding right. That's true, but you know what? It also has to do with how the mom's eating when she's pregnant. Has a lot to do with that. So we'll go through this. Okay. All right. I like this slide, and I hope I can explain it. I love this slide, this concept of this slide. We have right up here coronary disease, cardiac arrhythmias, heart failure, stroke, cognitive decline, symptoms and disabilities, subclinical vascular disease, dyslipidemia, hypertension, diabetes, inflammatory pathways, thrombosis, arrhythmia risk. The point I want to make right here is the current model that we use in healthcare is all dealing with this. Do you follow that? And that's the end result of all this. This was actually published in Circulation. They were making the same point I'm making right here. This is a prime medical journal that's making the point that we're making right here. I may disagree with a couple of these things down here. I might add a few things. I would add a few things in here that are not here. But I love the concept of it is that what the concept here is that from a health perspective or a medical perspective, we're really only dealing with this right here. We're not dealing with these problems down here. Right now, in the different schools, health schools, and even in medical school, I'm not trying to rail against that, just these are the facts. They get 25 hours of nutrition through the whole time. And they found that 1/4 of the medical schools are complying with that. So 75% aren't even complying with the 25 hours, which you guys are spending an hour here. So you got one of your 25 right here. So yeah, I'm not trying to rail against anybody, but I'm just saying the way we're doing this is causing us problems, and we need to change the way we're thinking about this. If we continue to, you have high cholesterol, take a statin. You have inflammation, take this. You have a blood sugar problem, take Avandia. By the way, Avandia for blood sugar causes heart attacks, and statins for cholesterol causes blood sugar problems. It's like Farmageddon. You know, everything's causing everything. Why is that? Because we're not addressing root causes. Now, what I would put under here is I'd put blood sugar down here. I'd put adrenal health. I'd put toxicity. I'd put allergens, food sensitivities, dietary habits, exercise. I'd put these things down here. We correct these, 95% of the problems would go away. Because we're fighting diseases, we shouldn't be fighting diseases. What we should be doing is correcting causes. Okay. I kind of felt like I was preaching there. I apologize. Anyway, extra weight is a major cause of insulin resistance, and insulin resistance is a major cause of, you know, this is kind of funny. You got the BMI. You have the BMI test. They do the body mass index test and so on and so forth. I like this test. You know, if you're in the morning when you're weighing yourself, you just get up and you stand in front of the mirror and you jump up and down. If you jiggle, then you probably are high. So anyway, that's it. I shouldn't have said that. Wow, that sounded a lot funnier in my brain before I said it. Okay, good. It was not. I retract that statement. Okay, weight gain leads to insulin resistance. Insulin resistance leads to higher levels of insulin. Higher levels of insulin relates. You see the cycle? We can break the cycle. Remember what I said, genetics, epigenetics? We can turn the genes on, we can turn the genes off. So I'm going to show you how in just a little bit. I mean, you know, I guess that's fine. But, I mean, we say that. But here's the thing. We are really battling with a level of, I think it's just not knowing the consequences of what we're doing. You know, I saw a child one time in a baby carriage and had brown liquid in the bottle. I asked the mother, what's, you know, and it was soda. I said, I mean, that's too far gone for me to address. I mean, you're already over the cliff. I mean, I apologize if you've done that. I'm not trying to hurt your feeling. I'm just saying we've got to take care of ourselves. When I was 20 years old, I could do anything and get away with it. I can't do that. I've got to take care of myself. This is just this is inside lining of the artery right here. It gets damaged. That whole cascade of events that we just talked about right here. Okay, low blood glucose levels. Why is that bad? Well, your brain needs energy, right? The rest of your body needs energy too. If your body doesn't have energy, it can't produce its stuff properly and things go haywire. But the brain is the #1 consumer. It needs the sugar. It needs the sugar. That's the reason why when we see somebody have stroke or somebody has a brain tumor or something like that, a lot of times you'll see, oh, you know, Johnny used to never like sweets, but now he can't get enough of them. That's because the brain his body's saying, give me some sugar. So high blood glucose levels, these are not good either, because there's a lot of bad things that happen with high blood sugar. It's called hyperglycemia. You may be hyperglycemic but not diabetic, and there's different guidelines for that, but if you have a fasting glucose of 100 to 120, you're probably pre-diabetic. People will argue about that, but you know what? I care about that, but I don't care about that from this standpoint. What I care about is if you've got hypoglycemia or diabetes, or you've got pre-diabetic, we're dealing with the same situation. It's just you're a different level of the continuum. And we have to find out why you're doing that and turn around. By the way, we've seen the worst diabetic cases on insulin. If they get on the right program, they can reverse that. Diabetes, my dad used to say this. He said, diabetes should not be considered a disease. It should be considered a condition, because it's completely reversible by right thinking, right living. Okay, hyperglycemia, advanced glycation end products. These are the bad things that happen when you get a lot of blood sugar. You get a lot of blood sugar running around your blood. It causes a cascade of a whole bunch of events, and these molecules that come out of that cause a lot of damage to the inside line of the arteries. You have a lot of age. It will cause you to have a lot of age. Okay, vascular constriction restricts blood flow and can have effect on nerves, especially periphery. Okay, damage to retina and eye, kidney damage. We know about these, atherosclerosis, and slow healing process by decreasing available oxygen, and competes with vitamin C. Okay, and that's just a picture. Very good. And there's another part of coronary heart disease. Okay, I'm going to shift gears here, and mechanisms and causes and risk. I'm going to talk about this for a couple minutes, and then I'm going to talk about the good stuff. What are we going to do about this? How can we take care of ourselves to make ourselves better? Risk factors. I want you to pay attention to this. Risk factors. Somebody has hyperinsulinemia, they get Actos, Avandia, they get this other. Hyperglycemia, they get oral hypoglycemics, metformin, glucophage, all this. Their hypertension, they get antihypertensive. Their dyslipidemia, they get statins. They have their blood's clotting too much, they get these others, they get the ASA. The point I'm making here is this, that these are all treatments for what are called risk factors, and risk factors are only expressions of the body not working right at that lower level, coming from diet. How's the gut working? Do you have food sensitivities? How's your blood sugar going? How's your adrenals working? These are the things that are driving these things. You see what I mean? So what this is largely doing is going after the effects of the problem, and that's the reason why we are not having success with this model, because we're not treating the right problem. Okay, all right, I am preaching. What do you do, what to do, and what not to do? Do you like my smiley face? Okay, very nice. Digestive imbalances. When somebody comes into this office, if somebody comes to this office and they come in and say, they never do this, but I'm sick. I'm going to check them to see if their head's on straight. And I'm also going to look at their digestion, always, without fail. I'm going to look at their digestion. I have a child that comes in that's having colic. Check to see if their head's on straight, make sure everything went right through the delivery process. I'm going to get them off the milk, and if the mom's eating wheat, I'll probably get her off the wheat if she's breastfeeding. If an adult comes in here and they've got all kinds of inflammation that just doesn't make sense with just having minor problems, you know, they've got a lot of inflammation going on, I'm going to straighten out the digestion. We've got to get, look at this, the inner tube of life. That's pretty funny. Okay. The connection between gut flora, microbiota. The gut microbiota, that's what's going on in here. There's about 500 strands of bacteria in your gut, and there's a balance going on all the time. And that balance is very necessary for us to have normal health. Several factors shape the gut flora during infancy. Mode of delivery. Did you know that the mode of delivery will actually alter how the gut is formed? The vaginal birth is important actually for the normal flora to be laid down in the gut. You wouldn't think so, but we know that through science, through checking that out. That doesn't mean if you've had a C-section the ball game's over. It just means now you're going to have to do extra work. You're going to do some probiotic work, prebiotic work. You're going to have to do some things to establish a normal flora in there. How many people actually had a C-section or were birthed another way that I don't know of? But anyway, now that I'm thinking about it, sorry, just had a brain fog, I guess. But anyway, a C-section, how many people are having problems? They're 25 years old or 35 years old, and they're having diabetes, or they're having blood sugar problems, they're having whatever kind of problems they're having, maybe it's fibromyalgia, chronic fatigue syndrome, whatever it is, and without them knowing it, it's because they've had 25, 30 years of having a microbiota out of shape. In other words, the gut was out of shape. Could that happen? Yeah, it happens all the time. Happens all the time. We see people like that. We're like the gut fixers. You know, people come in here, we fix the gut, they get better. I mean, that's just how it happens. We've got to fix the gut. Hospitalization, prematurity, antibiotic use. You know, I'm really against this, and I'm not going to preach on this because that's a different subject for a different day. I'll just say this out here, that we way overutilize antibiotics. And when we're doing that, we think, oh, just take that antibiotic and that sinus infection will go right away and little Johnny will feel good. You know, that's messing stuff up in there. Now, we do have prebiotics, probiotics, and other things that we can do. If you've had antibiotics in there, we can fix that up. I mean, you can, there's ways. I mean, we've got technology today that really is helpful in that. But my point is you know, for my children, I don't want to go there unless I have to. If I have to, I'm all for it. I mean, if I have to, you know, praise God, we have the technology to do that. But I'm not going to do it frivolously. Dietary nutrients. Okay, and role of Western diet in promoting obesogenic gut microbiota is being confirmed in subjects. Okay, this is just showing, and this is the reason why I show this, is that the way you eat, watch this, food is information. Watch this. We used to think of it as just like fat, protein, carbohydrate, get it in and get the right balance. But actually, our food is actually talking to us. I mean, okay, if you just take that out of the tape, you're going to say Dr. Kessinger's crazy. So let me back that up a little. Our food is actually information. In other words, it's going into our body, and it's breaking down into particles, and they're even showing that RNA from plant food is circulating in our blood, turning on and turning off genes. So the foods that we are eating, it's not just a matter of, you know, I want this, I want that, or my balances, but think of it this way. When you're eating food, it is actually telling your body what to do, whether it's telling it to do something good or telling it to do something bad. So very interesting stuff. Leaky gut and diabetes, there's a link. I just want to show the gut thing, and let's move on because we've got a lot to do here. Okay, probiotics are necessary in our environment. There's just studies here. You'll get the PDF, but I just want to show you. It's important to take a probiotic. I take a probiotic every day. Food sensitivities, let me just say this about food sensitivities. If you have a food sensitivity that is unidentified, you may do everything you want to in order to get your blood sugars right, but you won't do it. Because without you knowing it, you've got a blind spot there. You're eating something, and it could even be asparagus or something you think is really great, that is triggering your body to have a response, and it's messing up the gut, and this can have you continuing having blood sugar problems. I want you to think past just the thought of, oh, if I just eat good food, I'll be fine. I definitely want you to think that, but we have to think beyond that, because it's not just the good food, it's what is the good food for you. So it is important to know what your food sensitivities are. And when somebody comes in here and they have a problem that's, you know, more than the usual, that's my first place. I've got to go to the food sensitivities. Why is that? Well, first, because my dad told me to do that. But I found after doing probably over 500 tests, or nearly 1,000 by now, that when people follow that food sensitivity, we nearly always see great success. Okay, central obesity is more dangerous than, you know, is the most dangerous kind. No, I'm not doing that. Okay, good. This is a picture of my plate. I was at my mother's house in Rolla, and my lovely wife made me something to eat, and I was eating it, and I was halfway through eating it. I even had my fork down. So I got to take a picture of that. That's pretty cool. I took a picture of it and put it on Facebook, and had all kinds of likes on it, which made me feel good. But anyway, this is what a good meal looks like. See all the colors in there? You got the yellows, the red, the greens, and all that. It's got some turkey. Now that turkey was natural, non-antibiotic, non-hormone. Doesn't have any gunk in it. We get it organic. This is another picture of something that's cooked up that I don't know what it is, but it looks good. But guess what? This stuff is talking. This stuff is signaling receptors in your body to turn on genes and turn off genes. This stuff turns on the good genes and turns off the bad ones. If you could do this every day, all the time, I'm telling you, it would make a major, significant change in your health. Paleo diet, I'm going to go through this. I've got a handout for everybody. You can look at this, modified paleo. I'm going to skip through this because of time constraint. Managing your blood sugar, insulin, diet, exercise. These are really the three prongs. We've got to get our diet and our exercise right. Okay, What am I going to eat? That's actually a really good question. Now we've gone through this, what am I going to eat? Phytonutrients. Anybody heard that word? Because you're actually going to be hearing that word a lot, because a lot of people are talking about it in the functional medicine circles, or what I like to call investigative healthcare. We want to investigate what your problem is and fix it. Phytonutrients, as it turns out, we used to think of things like carbohydrates, fats, and proteins. But now we realize when we look at broccoli, it has all kinds of good stuff in there, and some stuff we don't even know yet. There's a lot of good stuff in there. It's called phytonutrients. They're all the essentials that go in to help all the stuff work. Vitamins, minerals, all the good stuff. Unprocessed, very important. If you read a label, and it has over 5 ingredients, you better know what the ingredients are. I mean, that's all my suggestion is. If it says natural flavors, many times it has MSG in it. Watch the aspartame. These are excitotoxins. Remember what I said before? If your sugar goes down in your brain, it leaves you defenseless against the excitotoxins and causes damage to neurons in the brain. You don't want that to happen. Low glycemic index, anti-inflammatory diet, that's the paleo diet that we're going to share with you. Enriched omega-3s. I like krill oil is good. Also fish is good. You know, we have a problem with some of our fish, like in the fish ponds, may have pesticides. Watch that. Also mercury. That's the thing. So I actually supplement. I suggest supplementing omega-3s. I do that. I do eat some fish, but I encourage you to supplement with omega-3s. I don't like to have to do that, but the fact is that we're getting too much mercury from the fish. You eat a little bit of it, your body can clean it out, but I'm not going to eat fish every day. Spectrum of colors of food. Eat your 5 colors. You've heard that before, right? Healthy gut support. Eat things that are good for your gut. In other words, if you have food sensitivities, you got to stay away from those. But here's the thing: once you heal the gut, a lot of those sensitivities will actually go away. Okay, somebody say thank you. Everybody said thank you. Thank heavens. No, once we heal the gut, wow, that was the biggest sigh of relief I've seen since I've been in practice. That's great. No, but we have a program. I'm going to show everybody this program before we leave tonight. Okay, food as medicine, nutritional balance, macronutrients. We think about our fats, proteins, carbohydrates, and as on cell signaling. So they're signaling the gene expression. Macronutrients, the quality of the phytonutrients and the glycemic load. So we're looking at what kind of good stuff. Like if you eat a cheeseburger and you got like the white bun, how many phytonutrients do you think you can find off of that? Probably exactly. You got 0 right there. Matter of fact, Dr. Whalen had a hamburger back there. I think it was like a 1/4 pounder that he bought like 2 years ago, and it still looks the same until I picked it up and tried to test it and I broke the bun, but that's another story. But anyway, yeah, he said, I've been doing that for like 9 months. I said, oh, sorry. Anyway. Start again. Okay, good. Quality versus quantity, food addictions, implications. Guess what? Particularly gluten. If you're sensitive to gluten, you can have receptors in your gut that kicks off something called a gluteomorpheus receptor that gives you a similar high to morphine. So there are actually addictive properties to some of the food sensitivity. So what we see is this, is if we can break that cycle, and usually it takes about 1 to 2 weeks. Once we break that cycle, that addiction's over. Most usually. Some cases are a little more complicated, but most are not. Once we get past that 1 or 2 weeks, and you know what? I'm saying that because I'm shooting long. A lot of people, 3 days. You'd be amazed. 3 days, you're done. So if you're having a food like, oh, I can't have that. Well, you're probably addicted. I'm sorry. That's the reaction you have. That's what you do when you're addicted to a food. So anyway, I had this one lady. I said, ma'am, you're going to really have to. She's drinking 6 Diet Cokes a day. I said, you're going to really have to cut down on those Diet Cokes. And I was saying as a casual conversation, like, hey Terry, you really need to cut down those Diet Cokes. And I'm getting ready to go do this, that, or the other, wash my hands or whatever. And I thought she was going to fall down right there. She stood up, and I can't do that. And she about attacked me. I need to conceal and carry in here. I'm telling you, it was serious. So anyway, people can be addicted to food. If you're addicted to food, that means you need to get unaddicted because it's not good for you. It's causing you problems. And you know what? 3 or 4 days, week or 2, you can do it. It's worth it when you consider a lifetime. Quality versus quantity. Very interesting. Not all foods are the same. Like if you get 1 calorie from this and 1 calorie from that, it's not the same. We used to do this. Oh, count your calories. You got to get this many calories, get that many calories. That's a false way to do it. Because remember, foods are turning on genes and turning off genes. If you eat bad foods, I don't care if you eat little of it, you're still turning on bad genes. So there you go. Okay, minimize and eliminate refined sugars and flours, minimize caffeine and artificial sweeteners. I just say, you know, artificial sweeteners, just stop that. Just if you don't freak out on me, because that was what that lady's problem was. She had a aspartame thing going on. But anyway, combine protein, fat, and carbohydrates to reduce glycemic load. If you eat a banana or you eat a fruit, never just eat a fruit by itself. Always eat some kind of protein or fat with it. And the reason why is because it will slow down that sugar spike. You slow down the sugar spike, you're slowing down the insulin surge. Got it? So pay attention to that. Here's another thing I'm going to say. This is going to be a sacred cow. It's going to knock you all down. But if you will follow this one instruction, it'll be a great deal for your health if you're having blood sugar issues. Do not eat carbohydrate breakfast. You must eat breakfast, but it must not be a carbohydrate breakfast. Everybody eats carbohydrate at breakfast. They eat their you know, they got their Cheerios or their toast or their jelly, their this, their that. I'm telling you, that's a bad time to do it, because right then the body's shifting gears where it's changing its metabolism on sugar, and that's exactly the wrong time for the body to have sugar in it. It needs protein at that time. What I do is I do a protein drink every morning, but I also that you can do coconut yogurt. It's good. You can do eggs, are fine. If you have a piece of fruit, that's fine, but make sure you have the protein with it. Does that make sense? Did you guys get that? I hope I did. I hope I didn't make you guys go to sleep before that point, because that's really important. Yeah, I know. Somebody throw him some broccoli. Okay, rye versus wheat, oats, and potatoes. Now they did a study, and check out what they found. This is objective. The main objective was to test whether 2 different carbohydrate modifications, rye pasta diet, blah, 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 blah. I don't mean to blah, blah, blah. The study was just trying to get through it. But what they did was they compared one group where was eating rye, and the other group was eating wheat, oats, and potatoes. And here's what they found. They found we detected 71 down-regulated genes in the rye pasta group. What does that mean? Down-regulated means turning off the bad genes. So people are eating rye, and it was turning off the bad genes. But watch this. In contrast, in 12-week oat, wheat, potato diet, up-regulated 62 genes. So what does this mean? That means that the group that was eating wheat, oats, and potatoes were up-regulating the bad genes. In other words, they turned on the bad genes. That's science. That's science. And here's the reference right down here. It's published in 2007. Dietary carbohydrate modification with rye and pasta or oat, wheat, and potato differentially modulates the gene expression profile in abdominal subcutaneous adipose tissue, even in the absence of weight loss. It's independent of weight loss. The foods you eat make a difference. Remember what I said. The foods are information. They're talking to your cells, and they're turning off genes, they're turning on genes. So it's important. So what does your refrigerator look like? Does it look like the right-hand side? Does it look like the left-hand side? Nutritional support. Here's some things that you can read later. Multivitamin I suggest for everybody. Chromium, selenium, magnesium, zinc, biotin, B-complex, your essential fatty acids, omega-3s, and vitamin D. Check your vitamin D levels. Make sure your vitamin D levels are good. And your vitamin D levels, I like to have a vitamin D level somewhere between 50 to 80. Blood sugar nutrition support, modified paleo, you're going to have the handout right there. High quality protein powder. And I suggest people do this unless you're going to eat the yogurt or if you're going to eat the eggs or something else for breakfast. What I do, especially like on Monday and Wednesday mornings when I'm usually in a rush going to the office, I walk into my counter right there. I put 2 scoops of my vegetable protein powder right over there, and I put another scoop of the multi-chocolate mix, which is, you think it's chocolate, but it's actually a something. So it tastes good. But anyway, it's a multi-mineral. It's got all kinds of stuff in it. I'll show it to you in a minute. But anyway, I stir that up and drink it, and that actually satisfies me for a good 3 or 4 hours. But watch this. When you start eating right and you stop eating all these carbohydrates and all these grains, you know what's going to happen? Is you're going to eat, and then 2 hours later you're going to be like, I'm kind of getting hungry. I'm getting a little fidgety. I'm getting hungry. Well, it's because your body is used to burning, it's not used to burning its fat that way for energy, and you're retraining it, but that's okay. Just make sure you're eating smaller meals throughout the day. That's all. I used to do this. I used to gorge and eat one big meal a day and actually even brag about it. I'd say, I'll just go home at night and I just, whoa, you know. But it's much better. Eat a good solid protein in the breakfast in the morning. Eat you a snack 10, 11 o'clock. Eat you a nice lunch. Eat you a snack in the afternoon. And then 6 o'clock at night, 7 o'clock at night. Eat something that's a nice quality. I always suggest that if we're eating meat, like we're eating beef, that you get grass-fed cattle, non-antibiotic, non-steroid. You know, this stuff costs more to shop like this. Do you know that? It really does, but it's worth it. It's really worth it. Current exercise recommendations, basically they say 30 minutes of moderate physical exercise at least 5 days weekly. This is American Heart Association, American College of Sports Medicine. Every day or 20 minutes of vigorous exercise. This is for people who are in that age category. They're in relatively good health. The basic point I want to make here is we need to exercise. Everybody needs to exercise. What fits your schedule better? Exercise 1 hour a day or being dead 24 hours a day. Okay, that's a little whatever, but so exercise is a big key. Provides wider range of benefits. 30 minutes. I mean, there's all kinds of stuff, but I'm going to say this about exercise: get a partner. If you'll get an accountability partner or get a group of people, it'll make all the difference in the world. You try to do it yourself. I'm a self-doer. I can do it. That's fine, but I just kind of have that temperament. A lot of people really do well when they get focused in on a group. They have a running group, they have a biking group, or they have a whatever type of group. One thing I didn't put in here that I neglected to say that additionally, their guidelines advise resistance training, weight training should be incorporated at least 2 non-consecutive days a week. So we need to be doing weight training. Weight training. Get a 5-pound weight. Yeah, do these. I mean, just weight training, there's a lot. If you want more information on weight training, I'll be glad to help you with that. I just want to get the point across that we must exercise, and I really am going to wrap it up just in a couple of minutes with this. Persistent organic pollutants. These are in our society. Guess what? These are called endocrine disruptors. Have you ever heard the word endocrine disruptor? That's something that gets into your body and it latches on to these receptors that are coming off those tissue cells and taking the place of like a thyroid hormone or an insulin hormone or something like that. These are endocrine disruptors. Pesticides are really bad. Agent Orange. I have some patients who were in Vietnam that was exposed to Agent Orange. This one guy said, "Yeah, I used to roll these buckets, you know." But anyway, that was Agent Orange, and unfortunately, he suffers with diabetes. One of the things that Agent Orange would cause is a blood sugar problem. Because why is that? It's messing up the receptors. The receptors don't see the insulin right. The body makes too much insulin. You get the whole cascade of events. Solvents, pharmaceuticals. BPA from plastics. Does anybody see my email that I wrote out about the BPA? BPA from plastics. If you're drinking hot coffee out of plastic cups, don't do that. You know, don't drink unless it says BPA free, because the hotter the liquid, the more the BPA leaches out. Phthalates, that also comes from the plastics. This is like the ATM machine. You get that little credit card receipt, or that little receipt thing right there. It's got that on that. So these are ubiquitous. In other words, they're all over the place. So what we have to do is just make sure we're taking care of ourselves the best we can, because there's some things we just can't prevent. Okay, danger list. You can read through this. High fructose corn syrup. Everybody knows that's a bad, right? Now, if you see, if it says corn syrup, it's high fructose corn syrup. That's the good stuff. Cutting cravings. I would like to have an explanation for that. I don't have one. Okay, that's a blender. Just put it all in there and drink it. Eggs are good. I put this in here because eggs are good. People say eggs aren't good. I like farm fresh eggs. No antibiotics. Eating off the farm. Eating the grass-fed. That's the way you do it. This is a guy by the name of Dr. Hyman. There are many good resources out there, and I recommend this book to read. It'll be in the PDFs. You can read that. It's an outstanding book. There's just all kinds of stuff. Now, okay. Now, wait a second. Before you say anything, I could have taken a picture of my daughter at this age, and it would have looked almost the same, just not the black hair. She didn't have any hair. And she was breastfed. So, I mean, sometimes, you know, babies are just heavy. That's just it. But after they, you know, after a year old and they start standing up, they start losing that, and that's just real thin. But I guess the point of that is that we should watch how we're doing this with our kids. I want to make one point here, and I told you I was going to land the plane, and I am. There was a study done by this guy that's a neurosurgeon that did something called microvascular decompression. Now, what he did was he found a way of looking at MRIs, and he could see the blood flow going on in the brainstem. And what he found was when he was doing this procedure on patients, that various things were happening. They first started doing it for like trigeminal neuralgia and things like that. But they noticed they were doing this procedure and people with high blood pressure was getting better. And they also noticed people with high blood sugar was getting better and different things were happening. Well, what's happening is the brainstem controls the autonomic nervous system. Autonomic nervous system has a lot to do with everything else. It's too complex for me to talk about all of that. But I just wanted to make this point that he wrote a paper, and in this paper he said, vascular compression of the medulla, possible cause of type 2 diabetes. Now the reason why I say that is because when your head is not sitting in the groove properly, it can interfere with the blood flow in the brainstem area in such a way. And we only suspect this clinically because I know I've seen people, and this blows me away, but I have seen people come in, I've not done any dietary changes, I've not done anything, and then they come in and say, you know what, doc, my blood sugar's doing better. And this happens a lot. I've not done any dietary work, I've not done anything with them, simply adjusted them, got their head on straight, and they come in and I'm checking their blood pressure drops. Why is that? Because we're affecting the blood flow in the brainstem area. When the head's not in the proper position, it can cause these problems. This is really what I believe this guy is doing, is he's going in there and manipulating the blood vessels. Basically what we're doing is just getting the head set down straight, and we're seeing changes from that. But anyway, it's very interesting. He had this quote. This is a very famous doctor in this regard to doing microvascular compression. He said, more and more I'm starting to think that type 2 diabetes may be a brainstem problem and that high blood sugar is just a side effect. Isn't that interesting? And so, yeah, is your head on straight, and optimal health requires education, dedication, determination. You got to do it. You can't stop. You have to do it. This is the chocolate greens, poly greens, chocolate greens. This actually has a probiotic in it. And for you chocolate lovers, this is actually okay. This is unless you have sensitivity to cocoa, then that's bad. Most people don't. But anyway, this has your vegetable blend and your antioxidant blend and your digestive blend. I take this every day along with this. I take 2 scoops of this, 1 scoop of this every morning. Now, you could, instead of doing this every morning, do this one morning, the next morning cook an egg, the next morning have coconut yogurt, the next morning come back to this or whatever, rotate it around. But if you're dealing with blood sugar issues, I really suggest that you do a good quality protein powder. What makes this good, and why this is the reason why I do this. This is the reason why I personally do this, because it doesn't have any whey in it from milk, and it doesn't have any soy in it from soybean, and so it's called hypoallergenic because it's made from vegetable protein. It's really good. It's a good source. I've been using it for a while. Now, if you're already on the trail of insulin resistance and some of those things really hit you between the eyes, like I'm insulin resistant or you're diabetic, this is what you need. This right here is called Ultrameal 360. This is specifically formulated to help people get their blood sugars back under control. This stuff right here is just general stuff that you do for your health. This is stuff that you do if you already have diabetes, you're pre-diabetic, you're already in that insulin resistant curve. There's one other thing about that. There's labs that can be run that will show us your status of how you're doing with your insulin resistance. Glucose tolerance tests are kind of hard to do, so I don't really like to do those, but instead I do things like I do the hemoglobin A1C, and I do something called an LDH. And LDH will give us an idea of your blood sugar levels, and we do other testing that will give us an idea of where you're at. So if you have any interest in do that, that was actually a pretty good one, Joe. If you have any, that was pretty impressive, actually pretty impressive. So if you have any interest in that, we'd be glad to get you that information. Exercise, 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 eat your colored foods. Make sure you're eating a good quality protein for breakfast. Stop eating the grains. Just stay away from the grains. They're just not good for you. Brown rice is really something that's okay. But I'm not an advocate of eating a plate of rice every day. But I think rice is probably out of the grains. It's okay. Any questions?